Thank you, Cancorla. As of last night, we had 16,671 confirmed cases of COVID-19 in our country, and sadly, 769 people have so far lost their lives. People with lives and stories, people who made a contribution, people who mattered, and people who will be remembered. The Government is eternally grateful to all of those working to combat COVID-19 and everyone who's playing their part in this emergency, whether through their work or simply by staying at home. The good news is that we now estimate the reproduction number of the disease is now between 0.7 and 1.0, and more information will be provided on the modelling by Professor Nolan later in the day. More people in Ireland have now recovered from the coronavirus than have it, and more people have been discharged from hospital than are now in hospital as a consequence of coronavirus. This means that our collective national effort is working, and we are suppressing the disease in our communities. So far, 130 people have been discharged home from ICU, having recovered, and there's been no overall increase in the number of people in ICUs in recent days. We've been battered by a wave of destruction, but as a people we have endured. I know that all of this is coming at an enormous cost, with people suffering increased anxiety because of the restrictions, people who've lost their jobs, and people who fear losing their businesses. The mission of the next government must be to bring the same focus and energy to rebuilding our society as we have done to facing this health crisis. Today, our new enemy is complacency. The real risk is that if we become lax in the next few days and weeks, we could lose control over the spread of the virus. So far, we have not been able to slow transmission of the virus in every setting, and its impact in long-term care residential facilities, both nursing homes and other care facilities, is great. Our most vulnerable citizens are at risk, and we're now taking action to control outbreaks and minimise transmission to protect as many people as possible. That involves increased testing, now that is possible, increased access to PPE, oxygen training, staff accommodation, and other approaches are being undertaken. We're also providing financial assistance for nursing homes so they can better manage their own response to COVID-19. International best practice shows us that an integrated strategy of rigorous sampling, testing and contact tracing is the best way of managing this crisis. Our approach in all of these areas has been robust and will help us plan for when we can safely ease the public health and physical distancing measures. As of last Friday, over 105,000 tests have been processed in laboratories, including a laboratory in Germany. The National Public Health Emergency Team recommends that we should try to expand our testing capacity to roughly 100,000 tests per week. That's a significant increase, but one that will be necessary as we plan to exit from the current restrictions and manage the aftermath. This is a big challenge. It might not be possible, but we will pull out all the stops to make it happen. The easing of public health measures will be gradual and will be done in a stepwise manner. It will require continuous effort by all of us to suppress and control this virus. We will not necessarily mirror the manner in which they were escalated, and we must leave a period of time between taking each step so we can monitor their impact and act if necessary. Certain stricter social distancing measures may have to be reintroduced if it looks like the virus is increasing again, and we've seen this happen, unfortunately, in Japan in recent days. Public health criteria have been developed by NEFIT based on the work of the World Health Organization, the European Centre for Disease Prevention and Control, and the European Commission. The criteria set out are four. Number one, the instance of transmission, including in relation to outbreaks in residential and other healthcare settings. Number two, ICU occupancy as an indicator of transmission. 3, public health capacity, that is testing and contact tracing. And 4, overall health system capacity, including access to healthcare workers, beds and essential products and equipment. Extreme vigilance is required to limit the increase in new cases and prevent more deaths. And we must do everything we can to avoid a post-peak wave or a deadly second wave, which, as we know, occurred with H1N1 and also the Spanish flu pandemic in 1918. When this is over, we will awaken our society and our economy, and the actions that we take to do so must be done in a safe, appropriate, phased and timely way. I look forward to hearing members' observations and suggestions. Thank you very much.